Always.
So, which one of the following antibiotic is not a bacteriostatic agent? Macrolide, tetracyclines, clindamycin, rifampin. For this, there was a nice mnemonic which said ecstatic is about bacteriostatic. So in this, ecstatic is for bacteriostatic. In this, we have the erythromycin, yeah, the macrolides, clindamycin, sulfonamides, trimethoprim, tetracyclines, and chloramphenicol. And for there's another one which says very proficient at complete cell murder, which is bacteriocyclic. So the V is for vancomycin, penicillins, fluoroquinolones, aminoglycosides, cephalosporin, carbapenems, and metronidazole. So here the answer would be D.
Yeah, D is correct.
This is just something you can remember for back. You can use. Anyone wants to add anything?
Yeah, I think just on the antitubercular agents, among the first line, RHZE, it's only ethambutol that is bacteriostatic. All the others are bactericidal, rifampin, isoniazid, and pyrazinamide. But ethambutol is the only bacteriostatic antitubercular drug among the first line agents.
TB drugs are bactericidal.
Yeah, the first line.
Yeah.
Yeah, except for ethambutol.
Anything else? Maybe somebody has to add. Let's talk, please.
I don't have anything else to add. We can just move on because no one is unmuting. Basically, it's just few people who are talking, and
Thanks.
it's not even a discussion. It's like just yeah, it's boring. Please, guys, unmute.
It's
to make
okay,
it
let's
more.
make it like
Will do.
Huh?
Shrina, so this
Yes.
mnemonic, the bactericidal one, where does the F come from, Mama? We just the fluoroquinolone.
Proficient.
Or the F on the proficient. Okay.
Proficient. Very proficient at complete cell murder. Yeah.
Okay.
Hmm.
Thank
No problem. Valacyclovir is used for management of infections that are caused by herpes simplex, mycobacterium avian complex, pox virus, influenza A virus. Herpes? I'm not sure.
I think it's happy.
A.
Yes. Let's. We could talk about the herpes virus or the different.
Yeah, there are DNA viruses. I think they are envelopes. Not so sure about that one. Maybe someone can confirm. Then something unique about them is they establish latency. You get the first infection, but they can establish latency, such as chicken pox. Then later in life, you get shingles.
Yeah, they're enveloped.
The envelopes, nice.
Then there are 3 classes or how many?
Yeah, there are 3: the alpha,
3
the
classes.
beta, and the gamma.
Yes. The alpha, beta, and the gamma. Also, they can either cause the infection is either for which one? Is it herpes? I don't know
Herpes
which class.
simplex. Herpes
Yeah,
simplex virus
they
causes genital herpes
yeah,
and the oral. Yeah.
yes.
And then the varicella zoster causes, I think, chicken pox and shingles. Yeah, that one that guys was talking about.
Yeah.
Yes, let's be discussing like that. Mhm. Even if we don't know the whole thing, maybe we can just recall a sentence and then you can tell us. It's going to be helpful.
The mode of transmission for type 2 could
Yes?
be, I'm saying for the mode of transmission, could be sexual, skin to skin contact, fluids,
Ready?
skin to skin contact.
Yes.
Bodily fluids.
And the fluids now, saliva, semen.
Wait, herpes the one that
Guys,
people.
naweza tuambia jiflikuwa nayo.
Herpes is the cold sores. In
Yeah,
causes-
it's a console. Ni manzi yako manzi.
Also, the HSV1 is the one which causes oral, and the
Yes.
HSV2 is the one which causes genitals mostly, but sometimes they can be an interchange, like the one causing the other.
For this, am I missing out anything? You said it causes chicken pox, eh?
Yeah, chicken pox, yeah. And shingles.
Yeah.
And shingles, yeah.
Yeah.
Mhm.
Yeah, I think that's it. Yeah, treatment, acyclovir or valacyclovir or famciclovir. Just these acyclovir derivatives.
What else?
And then like guys said, they establish latency. So they're latent, like they usually are in the ganglion, and then when they are reactivated, they travel back to the skin. So when they're latent, they're usually like in the ganglions, and then during active infection there, it's like on the skin or any other. Yeah.
What could be for the diagnosis?
Pardon, Shina.
For diagnosis?
For diagnosis is mostly this is PCR, the polymerase chain reaction. Yeah, or serology.
Should we talk about all the viruses that are mentioned here, or what should we do?
Yeah, let's do that.
So that even if in the next questions, if we see them, we just have to brush.
Yeah. If we see them in the next, we move irregardless.
And also, if they're not there in the future, if it comes in our papers, it's going to be easier.
Yeah.
The shingles, is it the one which is causes one side infection, like only one side of the body, Ama?
Yeah. As
There's a
Gerald
term for that. What was it?
called dermatosomal distribution.
Oh, okay.
Yeah.
I can mention about the pox virus. We're going to do another virus, right? It is a double-stranded DNA. It is enveloped. Look, can you hear me?
Yeah, we can.
It causes the smallpox and also the molluscum contagiosum. Normally, its transmission is through contact. That is all I can remember.
Also, respiratory droplets. That's okay. That's contact. For
Pardon, Trina?
it's also respiratory droplets, yeah, which is contact.
Are you asking if it affects the upper respiratory?
No, I'm saying mode of transmission is by respiratory droplets.
Yeah.
So yes, it causes.
And then
upper-
it spreads to the regional lymph nodes.
It causes smallpox and monkeypox.
This is small
Even cowpox.
cowpox.
Yeah, that's what I can see here. Monkeypox, cowpox, smallpox.
Uh-huh. Oh, I wanted to confirm for herpes, we don't have any vaccine, or do we? I'm not really sure.
We have
I don't
for
know.
shingles, the one you were mentioning before.
Yeah, for
We
the
have a
Shingles.
vaccine for that.
varicella-zoster, yeah.
Okay. So smallpox had a vaccine, yeah?
It's called Shingrix. Let me just write on the chat.
And
Till then, so that,
is the
yeah,
vaccine live or attenuated?
good question.
Was
I
the
think it's
smallpox
attenuated.
eradicated? Like, is the smallpox vaccine still being given, or it was eradicated?
It was eradicated, I think.
Eradicated.
Oh, eh.
For the smallpox, it was a live vaccine, eh?
Yeah, I've seen it. It's live.
Mm. Smallpox. Anything else?
For diagnosis, I've seen PCR
Uh-huh.
and some immunology. Wait. So some immunological tests.
You can also use,
Yeah,
I can see intracytoplasmic inclusion bodies in cells are scrubbed from skin lesions.
are those lesions like checked under the microscope, Amma? Because I'm seeing somewhere electron microscopy is used in diagnosis as well.
The- You're breaking, Latin.
Unaweza nisikia sasa?
Yeah.
Nasema are those lesions like scrapings checked under the microscope? Because I'm seeing somewhere that the diagnostic tests could also be electron microscopy.
Yes, yes.
Yeah, they detected these skin lesions. I think they check the DNA containing antibodies from the lesions.
And how about the ELISA?
Hmm?
How about ELISA test?
Yeah, I'm not sure. Maybe someone.
Who's that? You're breaking. Shrina,
Hmm? It's not me.
is that you was talking?
No, no, it's not me.
Mm.
I think it was Fatma. No,
Okay.
she's
No,
asking about.
it wasn't me.
It wasn't you.
Yeah, it's me, Hamimti. I was asking about ELISA, if it can be detected through ELISA.
It can be.
Yeah.
Since it's eradicated, I don't know if we should talk more about it. Anything else that somebody wants to add? We can talk about influenza. Hello.
Influenza, it causes it's
Yeah.
referred to as the flu, and then it has those two surface glycoproteins, so you characterize them into based on those glycoproteins. So the first one is hemagglutinin and neuramidase.
But that's specific to influenza A.
E-
Yeah.
yeah.
Really? I thought
Is it
there's
specific?
influenza A, B, and C, then the C is not medically important. So A and B have both these hemagglutinin and neuramidase.
Oh.
Yeah.
I thought it was
Yeah.
specific.
Then as Hirali say, now they are characterized by them, like you say H1N1, H1N2.
Oh, okay.
Mm-hmm.
Negative strand RNA virus.
Influenza is negative standard. Yes.
Or then hemagglutinin works for entry of the virus into the cell. Neuramidase works for exit of the replicated virions out of the cell.
I don't understand. It had the antigenic shift, yeah?
Yeah. We have here the antigenic shift and the antigenic drift.
Then
Then it causes flu. A complication can be pneumonia. It causes pneumonia. Yeah.
Plain on the ship drift stuff.
there's pneumonia. Influenza B is the only one that affects humans. Yeah.
No,
Influenza A can also be caused, the host is also humans with other animals, but for B is just humans.
bees. Oh, okay, nice.
So like influenza A, it can affect, the host is humans and pigs, mammals. Influenza B, what's happening? Just a minute. Influenza B is I can't see what I'm typing. Is for the humans only. Influenza C is humans and pigs. like that. And influenza A is the one that causes antigenic shift and drift, but B and C is just drift.
What does this antigenic shift and drift mean?
Like they can move from, I think it's when you can transmit it from human zoonotic to us. I'm not sure. Antigenic shift is like a genetic recombination of humans with animals. And antigenic drift is like just a point of mutation in the gene itself. I don't know, somebody can correct me.
Can you
No,
repeat?
I think it's like that because for the antigenic shift is whereby even the virus will change its subtype. Yeah, there'll be major changes until the virus will change its subtype. But antigenic shift, there's just some minor changes, so the subtype remains the same. But there's some, just as you say, the point mutations.
And also for influenza A, the most common family is the birds.
Sorry?
Most common for influenza A,
Yeah.
it mostly affects the birds.
Bat.
Birds.
Bad.
Nyonde.
Please spell Nightwing.
Bird.
Like
Nyonde mse. Yeah.
that. Anything else?
Is this this antigenic drift? Is it the one that makes it hard for scientists to come up with a vaccine? Since it's always mutating and changing presentation, makes it hard to target the virus.
I'm not sure.
Yeah, I think it's,
Can I
Maybe
please
that.
repeat?
Yeah, I want to add something.
Yes.
The difference between antigenic drift and antigenic shift. Antigenic drift is when drift occurs when viruses undergo gradual mutations in their genetic makeup, but antigenic shift occurs when the viruses undergo sudden change in their genetic makeup. One is sudden, another one is gradual. The drift is gradual, yeah,
Okay.
and the shift is sudden.
Mm-hmm.
Hiral, I was saying.
Yeah.
That so this antigenic shift, it makes it hard for a scientist to come up with a vaccine. Because, for example, say we're going into the flu season, and you come up with a vaccine to target a specific virus that you know how it presents, maybe say in August. But then that certain virus mutates into a different another presentation, which means the vaccine that you had previously made to target that specific virus will not be as effective since the virus has been altered or has mutated. So that's why I think the influenza vaccines are not very effective.
So it's because of these mutations that it's difficult to make a vaccine or
Yeah.
I thought they isn't there a flu vaccine?
no, as in there is a flu vaccine, but then
Flu vaccines.
yeah, there is the influenza vaccine, but it's just like it's difficult because of these mutations, this antigenic drift and shift. They can change, like maybe some of the vaccines are not what do you say?
As in they have a long lasting immunity towards the vaccines,
Not
right?
lasting, as in because they keep on changing. Some vaccines will not be active against some of the influenza viruses because of because of these mutations.
Wow, okay.
Yes, that's what I'm saying. They develop a long lasting immunity.
Or the
So the
virus.
vaccines cannot work
The
against.
virus.
Yeah,
The
virus
virus.
develops.
Oh, okay. Yeah.
Yeah.
It's like kind of like resistance against the vaccine.
Is it against the vaccine?
Sasa mmefanya nini? For discussion but imekata haunisumbui. Si ulikuwa umeenda kuuliza, hata sikuwa najua umeenda kumuuliza.
Or it's the virus is resistant to the vaccine.
Vaccine. I thought the vaccine like is
Res-
helps
or
the body build the immunity. See, like a vaccine, you're introducing either a live.
Yeah. Black Panther. Yeah, you're right. It's when there's that antigenic shift is when now, as Jai was saying, we need to create a new vaccine. It's not that the organism has developed resistance, it's that there's been an antigenic shift. So because it has changed its subtypes, that vaccine was specific for the subtype that it was, but now it's a new subtype. So we need to develop a new vaccine against this new subtype due to that antigenic shift.
Yeah, because I think it's the body that will fight the virus, not like our body's antibodies are the ones to fight the virus and not.
Yeah. I'll send a picture to the group just summarizing why sometimes we hear the flu shot from last year is different from the one this year, such things.
Spider-Man.
Are we moving to the next question, Ama?
Also, some of the drugs used for influenza A is amantadine, which is like to prevent influenza.
How about cough suppressants?
Yeah,
The person has cough
analgesics.
symptoms.
and all. You just treat it.
Yeah, are we just managing the symptoms or?
Yeah, you just manage
Yeah.
the symptoms. Nothing what you can do. Okay. I think we can go to the next one. Which one of the following statement regarding anti-cancer drug is not true? True. Prednisone is cytotoxic to white blood cells. Cyclophosphamide is an alkylating agent. Folinic acid rescue minimizes toxicity induced by methotrexate. Vinca alkaloids promote microtubule formation.
A. Yeah, A.
Anything to discuss here? Like the different classes of anti-cancer drugs or something?
Sure.
Everyone has gone to sleep.
I can talk about a few.
Yes.
So there's a first class of the antimetabolites where we have the pyrimidine analogs and the purine and purine antimetabolites. So for the pyrimidine analogs, we have the likes of fluorouracil, capecitabine, cytarabine. Yeah, I don't know. Their mode of action would be to inhibit the imidylate synthase. Yeah, which will inhibit the thymidine formation. And remember, these ones are also given with leucovorin, which increases the affinity for the fluorouracil. For the purine and purine antimetabolites, we have the likes of mercaptopurine. Yeah. So those ones, they just inhibit purine synthesis. Also, we have things like the microtubule targeting agents. This is where we have the vinca alkaloids, the likes of vincristine and vinblastine. So they inhibit microtubule formation. Also, we have the topoisomerase inhibitors. Sorry?
Yes. I was going to say
Or
the
topoisomerase inhibitors. Here we have the likes of epipodophylotoxins, the likes, for example, etoposide. We also have camphothecin derivatives. For example, irinotecan and toposetan.
Brenda,
I'm
just
not
a
sure.
minute. Just a
Okay,
minute. Sorry, I think the answer is D because vinca alkaloids, they disrupt microtubule formation, while
yeah.
prednisone is it is cytotoxic to white blood cells.
How?
Yes, I also think the answer is D.
But I
No,
thought,
it's
okay,
prednisone.
I thought they just have immunosuppressive effects. I don't think they're like really toxic, cytotoxic to white blood cells. So I think A and D are an answer. I don't know.
I was also thinking the same way. Because I'm like from what I've searched, it's saying that prednisone can induce leukocytosis. That means less white blood cells, right?
Yeah, dying of heat stroke.
Because D
Oh
can
yeah, it does reduce.
Answer is D.
So toxic means like kill like the
yeah.
leukocytes or not reduce. So also A is not true. Ama?
But if you would
Yeah, it is not
for
true.
that, I think you'd go for D because it's like completely wrong.
Oh yeah,
The
yeah.
like if you choose for them from both of them. Yeah. Okay. Brenda, you can continue.
Okay. Okay. Also for these the microtubule targeting agents, I forgot to mention the class of taxanes. For example, paclitaxel. These ones, they are the ones which promote microtubule assembly and inhibit microtubule disassembly. For the vinca alkaloids, they're the ones which inhibit microtubule assembly. So I think it's good that we do not confuse those two. So I think I was at topoisomerase inhibitors. Yeah, so here we have the pipodophyllotoxins, the toposides, the camphothecin derivatives, the irinotecan. We also have the anthracyclines, for example, doxorubicin. Remember these ones, they form free radicals, which combine to form superoxides, which cause cardiotoxicity. I think that was the major side effect of doxorubicin. Also, due to its pharmacophore, it used to cause colored urine. Yeah, or rather color. Yeah, urine discoloration. And then we also have alkylating agents. These are the examples of an example was what, sorry? Cyclophosphamide. Yeah, and ifosfamide. These ones, remember, they used to cause I think hemorrhagic, yeah, hemorrhagic cystitis, if I'm not wrong. Yeah. And then we also have remember this one for the hemorrhagic cystitis, we used to give, was it Mesna, something like that, as the antidote. Yeah. Also, the other class was platinum analogs. These are the likes of cisplatin, carboplatin. Major side effect for cisplatin was nephrotoxicity. The one for carboplatin was mostly, like any other anti-cancer, was myelosuppression. Also, oxaliplatin, this one used to cause peripheral neuropathy, or rather cold-induced neuropathies. Yeah, I think that's it. Thank you.
Thank you too. Anything else that
There's
we should?
also epithelial growth factor receptor inhibitors, like the one for protein tyrosine kinase inhibitors. Example is I'll go to the examples of those, and then there's also monoclonal antibodies, cetuximab, the likes of cetuximab. For the monoclonal antibodies, they inhibit the ligand inducing signals, so they elicit immune responses. Yeah, we covered everything pretty much. And then this one for the growth factor receptor inhibitors, they used for solid tumors.
Thank you.
So, doxorubicin is the one which causes red urine, red or orange, some color, yeah. And also we can remind ourselves the drugs that cause the hand-foot syndrome.
What are drugs that can cause?
The hand-foot syndrome. Hand-foot syndrome, yeah. There's
Doxorubicin.
cabecitapine. I think we can all remember that one. Docetaxel, doxorubicin.
Fluorouracil.
Mhm.
Water.
Also
Cabecitapine.
doxorubicin.
There's supposed to be 5, I think.
And I don't know which one is missing.
Oh, cabecitapine. It's CAPE.
Just type it, please.
Okay.
Guys, we continue. Sure.
Yes, you can. You can read what I've.
I remove this thing that you're writing on top. It's blocking.
Oh.
Which one of the following drugs may not be effective for the management of megaloblastic anemia? Vitamin B12, folic acid, folinic acid, parental iron is not effective. D, right?
Yeah.
Yeah. Since megaloblastic anemia is deficiency of vitamin B12 and folate.
Yeah.
صفي عرب دير آموس.
We can talk about the megaloblastic anemia. Mama, we just continue.
We can talk about it, it's fine. It's a type of anemia that it's characterized by structurally abnormal and immature red blood cells in the bone marrow due to deficiency of vitamin B12 and folate. And the sum of management of megaloblastic anemia involves, like, you address the underlying cause So you give vitamin supplements, either vitamin B12 injections or the high doses, oral high doses of vitamin B12. And then also you encourage the dietary foods that are rich in vitamin B12, like meat, fish, dairy products. Yeah.
Clinical symptoms. Pale skin, yeah.
Fatigue, weakness, shortness of breath, feeling lightheaded,
headache, rapid heart rate.
yeah. Also, it
And
can
then,
be caused by, sorry.
Go on.
Also, it can be caused by the removal of part of your stomach, like gastrectomy, which may affect the vitamin B12 absorption.
Then some of the symptoms can be jaundiced skin, because the jaundice due to like the breakdown of the red blood cells in the bone marrow, you can have pale yellowish skin.
Then diagnosis, just blood testing. And the Schilling test is specific to vitamin B12.
Yes.
I think, I'm not sure.
Yes.
Yeah.
Yes, it is.
Yeah. Okay, I think we can move to the next one. Does anyone want to add on anything?
What did you say the diagnosis is?
Just the blood test, and the Schilling test is very specific to vitamin B12.
Thank you.
Yeah. Progestin only contraceptives should be avoided by lactating mothers, are more efficacious than combined oral contraceptives, exclude medroxyprogesterone acetate injection, and can cause irregular breakthrough bleeding.
I think D is the best answer there.
Yeah, I agree with you.
What anyone wants to add on anything? Anyone wants to add on anything? Or we move on? Which one of the following side effect is not associated with glucocorticoids? Immunosuppression, negative nitrogen balance, decreased appetite, and cataracts. Negative nitrogen balance, I'm not sure.
I was thinking the same, because A and D are out. Remain with B and C.
Glucocorticoids increase appetite or decrease?
Decrease.
iPhone, are you saying that's the answer, or you're saying glucocorticoids decrease appetite?
They do decrease appetite.
They do decrease appetite.
Yeah. So I think the best answer is B.
I think they stimulate appetite. I don't know why I feel that. Maybe somebody, I don't know.
Yes,
Let
the
me
answer. Yes, that's the answer because they increase appetite and cause weight gain.
Yeah.
Remember the moon phase.
Treatment with glucocorticoids causes negative nitrogen balance.
Yeah, the answer is C. So they increase the appetite.
Yes, they
Yeah.
increase appetite.
Or in order now they cause the moon phase. Weight gain.
So what is this nitrogen balance that we're talking about, and how do glucocorticoids alter it?
Okay, so I'm seeing this negative nitrogen balance. It indicates that protein intake is insufficient. And some of the causes can be like physical or emotional stress, starvation. But it's saying that how glucocorticoids affect that. It's like unknown kind of.
What I am saying is it occurs when urinary nitrogen losses are greater than oral nitrogen intake. Or is that what you said?
Sorry, repeat that.
Negative nitrogen balance occurs when urinary nitrogen losses are greater than oral nitrogen intake.
Yeah, basically, because if you're taking less nitrogen or protein, then yeah, basically that. But someone has written that glucocorticoids increase protein breakdown, which is catabolism, so they can cause negative nitrogen balance. So yeah.
How they actually this negative nitrogen balance comes about when the amount of nitrogen that's excreted in the body is lesser than the amount of the intake. So how glucocorticoids affect negatively is in the muscles they break down protein synthesis. At the same time, they inhibit the synthesis of proteins. So they reduce the like the body will excrete more nitrogen than it retains. So
since there is a negative one, there must be a positive nitrogen balance, right? And what is it?
Pardon, Shrina, what have you said?
I'm asking if there's negative nitrogen balance, then what is the positive nitrogen balance, and like what causes it? Which drugs, or I don't know.
It's just the opposite of negative. So this for positive is just that you're taking in more nitrogen compared to what is being lost or excreted.
But
The body is retaining more. Yes.
Yeah.
what could be the positive? Like, so I'm saying like for positive, if it's positive nitrogen balance, it will be seen in pregnancy and lactating.
And even during like the growth period.
Also, when like in
So
Cushing's, also in Cushing's syndrome, when there is prolonged use of corticosteroids, the body can enter a state of negative nitrogen balance.
I don't know if it will sound stupid or silly.
Huh?
So I have a question, yeah. So we've said that there's positive nitrogen balance when there's lactation going on. Yeah, never mind.
Yeah. What's
No,
your
it's,
question?
no, it's okay.
Okay.
During growth, pregnancy, lactation, and recovery from convalescence, the body is in positive nitrogen balance since it is retaining nitrogen for the purpose of synthesizing new protein tissues.
So it's the opposite of the negative. Like for the like right now, I said for Cushing's syndrome, when the patient uses prolonged use of corticosteroids, the body will enter a state that it leads to negative nitrogen balance since there is more muscles that are wasting over time, and the body breaks down more proteins to meet its energy. So Cushing syndrome is one of the negative nitrogen balance scenarios, prolonged use of corticosteroids in Cushing syndromes.
I think we can go to the next question.
Irregardless, Shrina, irregardless.
Which one of the following is an antidote for organophosphate poisoning? Pralidoxim, dimercaprol, EDT, or deferoxamine?
Pralidoxim.
We can
Before this, mshaongelelea antidotes anywhere else?
Yeah, hadi tulimanage. Itabidi umerudi YouTube.
All right.
Jokes, it's the first time.
Sasa mniambie zote mnajua.
there was
There was a picture Stano sent in the group, I think.
yeah, which this one?
Has I think it was BFARM or our board discussion group, either of them.
I can. It's BFAM. Should I just resend it?
Yeah, resend it to the board discussion group.
Sent on JPN.
Yeah, that one.
Yeah.
Guy,
Yeah.
there's this question yenye uliuliza last time, kindly unikumbushe. I think Divya answered, ilikuwa overdose ya what? Something.
Ati overdose ya?
Okay, kumbuki jina for sure, but the antidote was FS something. Hebu let me
Antidote for digitoxin. Digibind ama the
yeah.
ni hiyo ya antibody. Yeah, the digitoxin antibody known as Digibind is a common name. Yeah.
Okay, thanks.
Dr. Patel, I think because we have that nice photo with all the poisons and their antidotes, can we? I think we can move. Can have that as a reference. Yeah, instead of just writing. Yeah.
Yeah, I'm not sure. That's why I'm not writing. A survey is an experimental technique, also known as a cross-sectional study, is hypothesis study. Does not include a census. I would go B or C, I'm not sure.
Hypothesis testing.
Experimental technique or something.
I think experimental is when you are doing it in the labs. A survey is maybe could be a questionnaire or observational survey. I could be wrong.
I agree with you, Shrina.
A survey is non-experimental, but I think it's of a hypothesis. But the survey is also known as cross-sectional study or drug study, prevalence study. So I am not sure what's the right answer. But if it's an observational research, it's the time you can call it a cross-sectional survey. I mean, should I go to the next one or somebody wants to? Okay. Which one of the following is not a measure of central tendency? Mean, median, mode, interquartile range.
Yeah, for the interquartile range.
Incidences focus on the rate of appearance of new cases, is often greater than prevalences, is not related to risk acquiring a disease, or it's a ratio. Focuses on appearance of new cases, I guess.
Yes.
Okay. The control group is required in a cross-sectional study, should not have similar characteristics as the test group, should receive similar treatment as the test group, is included in a randomized allocation trial. B.
Yeah.
Will not receive. Yeah, it's the test group.
Wait, why not?
Sorry, C.
Why not C?
Yeah, C. It's the treatment
The
that
control. No,
Yeah,
the
but
control should not receive similar
the
treatment as the
characteristic,
test.
oh should receive.
but the characteristics,
Oh, sorry, it's the B
I think it's
because
B.
yeah, B. Guys, not C because it says not
placebo,
should.
the control group,
Because I
and
thought now we had, they've not defined, but we had positive controls and negative controls. And based on that, watch, I'll confirm, then just send to the group. Let me confirm what I'm thinking.
Like, do they mean treatments in terms of doses, Ama?
I was thinking that you give placebo to the.
Yes, sure.
So which is the answer here? C.
But you
Me, I
even
think it's B.
even B doesn't. If you go to C, B doesn't make sense because it's supposed to have similar characteristics,
Yeah.
but it's just that the treatment would be different.
I'm thinking C
Yeah,
is the answer.
yeah,
For B, it is should not have, not should not be there. They should have same characteristics. Now, since there's
yeah. I'm
no,
also thinking the same. Yeah.
yeah,
Because, for example, when we were working with the mice in the lab, we wanted, and we are testing a new anti-diabetic agent. We wanted all the mice to be diabetic. Then, I think that's a similar characteristic. But that choice B and choice C can be argued out. Yeah.
Yeah,
But
it
I
makes
think
sense after you explain now.
Yeah, I think C is better, but just
Because you induce the same like the same
condition.
disease
Yeah.
to all the mice, and then you test the.
Yeah.
Okay. Disinfectants are used on exposed portions of the body, used on operating room surfaces, mainly used as mouthwashes, are liquid preparations used to wash or rinse the throat.
B.
Biopharmaceutics is the study of factors that influence all the following, except the stability of the drug within the drug product. It really influences the release of the drug from the drug product, the rate of dissolution of the drug at the absorption site, and the research and drug discovery from natural resources. What affect the
B.
stability release. D.
Yeah, I think also D, yeah. Even Rami agrees.
Also helps to understand metabolism, disintegration, diffusion, or excretion.
Diffusion, yeah.
What does it state?
Hey, I just remember fixed, slow, and diffusion. I don't remember what
From
it
a
states.
higher concentration to a lower concentration.
Yeah, it's that one. I've been lying to me since high school. I thought it's my physics teacher that discovered that.
Tablets can be described as medications that can be made.
Excuse me, please.
Yes.
Please go to number 30. Okay, speaking of biopharmaceutics, bio means what? And I don't think it's the, oh, I thought you said it's the first one, sorry. I thought you said it's A, sorry.
No problem, no problem. Tablets can be described as medications that can be made easily in the pharmacy from aluminum and plastic molds. Dosage forms that should never be crushed or chewed. Pourable granules. Compact, compressed, or modern solids that may be swallowed. D.
I think
Yeah.
D.
Prefix in a prescription denotes an instruction to the pharmacist, an instruction to the patient's name and address, the prescriber's signature and address.
Pharmacy. Yeah.
Yeah.
Yeah, to the pharmacist. It
Introduction
indicates
to
gives. Yeah.
Which one of the following article is not used for dispensing oral solid unit dosage forms? Glass or plastic bottles, plastic or paper envelopes, paperboard containers or boxes, collapsible tubes.
D.
Sorry?
collapsible tubes.
Which of the following auxiliary labels should not be used when dispensing suppository? Stored in a cool place, not to be taken for rectal use only. Used in a suitable atomizer as directed. I think not to be taken.
Should not be used. That should be used.
Not, but see, you're giving the thing.
It's choice C because it is for rectal use. Rectal is different. For rectal, we give oh sorry, confusion at its best.
So which is the answer? Because A, B are correct. I don't know if C and D.
But you're giving for them to use it. Why would you say don't take it?
As in, not to be swallowed, not to be
Not
taken.
taken
As in,
is
it
not
means like that.
specified. Oh, someone is asking, do we use atomizer?
Yeah, that's the same thing I wanted to ask. Suitable atomizer. We don't use atomizer when you're using suppository.
What is an atomizer?
What? Yeah, I think, yeah, what's an atomizer?
I think
Yeah,
something like pressurized containers, like the aerosols. They break the dosage form into fine particles. I think that's what they call atomizer, but I'm not sure.
Then that makes sense.
So it's D.
A device that produces a fine spray from liquid.
Yeah, you see, it's us who don't know what atomizers are.
Those of us aerosols.
Colloids are fluid preparation for internal use, fluid preparation for external use, solid preparation for internal use, solid preparation for external use. What are collodions? I think they're liquid preparations for external use.
No
Yeah.
for internal. No for internal use. Like dextran. For internal.
I'm seeing colloidal definition.
They are used for
Flammable.
containing doxylin in a mixture ethyl ether alcohol to protect wounds or cuts. I'll go for this. Somebody was talking, I'm sorry.
I think it's there. Is it something like albumin colloid?
I'm seeing according to the definition, it's a mixture of alcohol and an ether.
Yeah.
It's for external use.
So collodion, not God.
Yeah,
I think
he is
you're
confusing with colloid.
colloids. Yeah, you're confusing
Yeah.
it with colloids.
Colloids is for
Oh, sorry. Yeah, that's colloid. Sorry, guys.
Are used to protect wounds and cuts.
Get your facts in order, Nightwing, please.
Colloids.
Hausner's ratio is calculated using the following equation. Bulk density over tap density over bulk density, port density over true density, or port density over bulk density, tapped over bulk.
Yeah, tapped over bulk.
A powder that has poor flow properties has one of the following. The Car index is between 5 to 15, 12 to 16, or Hausner's ratio is greater than 1.25 or less than 1.25.
D.
D. Hausner's.
And then for cars index, it's usually below 10. So D would be the answer.
Isn't value less than 1.25 indicates a good flow?
Yeah.
But this question is asking for poor flow properties.
Or poor. So that means for cars index.
Wait, how do you know the flow property is determined by which law? Like, is it the Car's index or the Hausner's index? I'd go for C.
Yeah. It's the Hausner's ratio that indicates flowability, while cars index indicate like it in for compressibility of the powder. So C, yeah. But just like in general for good flow properties, this Hausner's ratio should be less than 1.25 and Carr's index should be less than 10. And Carr's index is calculated as tapped density minus bulk density divide by tapped density times 100. So it's like a percentage.
You said it's used for?
Compressibility of the powder.
And how is compressibility related to the flow?
It is not related to the flow, but that is why we use Hausner's ratio, which is used to determine the flow property. It should be less than 1.25.
I think Sika's index it's an index for a measurement of powder flowability.
Compressibility.
No, it's flowability. Because you won't even know. For you to use the top density, the powder will allow you to know that the amount of packaging size. So the CAS index indicates better flow properties.
Yeah,
Like
the
you see,
Hausner's ratio, yeah, it's an
Yeah, and
indirect
like
measure of the property.
yeah, it's the same. Like one
Yeah,
is a direct indicator, and the other one.
yeah.
like you see for both of these, it's like tests for granules. So like I think the Hausner's ratio is like a direct property, while Carr's index is like kind of indirect, but it also shows the compressibility of the powder.
They both show
Okay.
flowability. I don't think they show compressibility. Because you can't know compressibility.
We did this with your
Because
short.
either way,
Yeah, I've sent the photo to the group to allay any fears.
Free flow. Oh, sawa, thanks. These are notes of
Okay,
Yashoda.
Yes.
No, these are my personal notes. They're on my laptop. So they're they're my notes.
Okay. Please share the other slide for hostess.
Okay. Let me share.
So do we yet go with C as the answer?
Without a shadow of a doubt.
According to Whitney's equation, which of the following statement is not true in regard to in vitro dissolution? Addition of wetting agents will increase the dissolution of coherent masses of particles. Porous particles will dissolve faster than non-porous particles. Agitation will decrease the thickness of the boundary layer. Agitation will increase the thickness of the boundary layer. Nightwing, I think you did this. Not sure.
Yeah, Nightwing did it very well. I think he can answer the question. We'll tell him the answer is between C or D, the two opposites.
D, I think. I think it's D.
Agitation will increase the thickness.
Not C.
I was also thinking it's C because when you agitate, more particles
You
fall.
decrease. Yeah, you decrease.
Yeah, C.
Nightwing, please give us the final answer.
Yes, Nightwing. It is. I don't know if he's here or he. He went. He saw the question coming and he left. He's come back. Nightwing is here.
But the question is which is not?
Yeah.
Not true.
see, it will increase the thickness of. It won't decrease.
Yeah, I also thought the same because when you agitate, the small particles will fall in between the bigger particles that were there, increasing the thickness.
Yeah.
And even how compact it will be.
So the answer
Thickness
is
of
D.
boundary layer. What is boundary layer?
Wait, but guys,
Mhm.
dissolution, the one with the dissolution machine, right? Mostly. Niko confused. As in
Ndio.
si kunakuwa na agitation ama haikuangi agitated?
Inakuanga nayo agitation. But does
mi
it
nikisikia
increase or
boundary
decrease? Me, I think it decreases. It
Sasa
increases
si-
and
I think it decreases.
yeah.
So I'd go with the
Okay.
D. Imechange answer.
no, it increases.
It
So that is not correct. The D is not correct. So the answer is D. It
Yeah, the
doesn't
answer is
increase,
D.
it's decrease. Yeah,
the answer is what again?
the answer is D.
D. Okay.
The pKa of a basic drug is 4.0. Assuming the pH of the stomach is 2.0, calculate the ratio of ionized to an ionized drug using Henderson's Hasselbalch equation. I don't know how to do this. Please, somebody.
You can start by writing the Hasselbalch equation.
Henderson Hasselbalch.
Because we did something similar, yeah. So pH is equals to pKa plus log conjugate base over the weak acid. So
For basic drugs, so this will be the conjugate acid over weak base, yeah? Okay, it's the same thing, conjugate
yeah,
divided divided by weak.
I'm finding 100 is to 1. Because now it will be pH, now it will be 2 is equals to 4 plus log, let's write x, easier.
2 equals to 4, yeah?
Plus x, knowing that x represents all that hula baloo. So the 4 will go to the other side, it will be -2 is equals to log x.
So anti-log of
Yeah,
4
so
minus
anti-log of -2.
100. 100 is to 100 is to 1. There are two answers.
Unajifurahisha nayo, unachukua moja unakwenda.
Yeah, you take one or you take both.
If there's an option of taking both, yeah, go for it. Which one of the following viscometer will be used to measure the flow property of a non-Newtonian fluid? Rational viscometer, capillary viscometer, falling sphere viscometer, Ostwald YouTube viscometer.
I think it's the rotational.
Yeah, those are the three for Newtonian.
Newtonian fluids. Sad
Newtonian.
thing.
Hello, was it antilog of 2 or antilog of -2?
Antilog of -2.
Won't that be 0.01 instead of 100 because antilog of 2 is 100? Maybe the answer should be 1 is to 100.
There's no answer like that. I think B and C, I think they wanted to play around with it, but a typo happened. Yeah, it's supposed to be 0.01. So should we continue, Amma?
Yeah.
Yeah, I think we can do one. Yeah.
Turbulent flow in rheology is characterized by all the following except movement of one layer of fluid to another without transfer of matter, a relative sudden increase in viscosity above shear rate, movement of particles from one layer of fluid past another with transfer of matter. There is need of a larger energy to maintain turbulent flow than laminar flow at the same velocity.
I think it's see the movement of particles from one layer fluid past another with transfer of water.
With transfer, without transfer.
I think I'd go for A.
Yeah, without
Without
transfer.
transfer. Oh.
Without transfer.
Yeah.
Which one of the following is not an application? Okay, wait, sorry. Does anybody have a different answer? Which of the following is not an application of adsorption from solution in pharmacy? Chromatographic techniques, hemodialysis, increase in potency of glycerol trinitrate tablets, loss in antimicrobial activities of parabens. Adsorption from
I think C.
Please explain.
Why not D?
I am very lost.
Okay, I don't know if this is the actual explanation. I'm just thinking. For loss in antimicrobial activity of parabens. Let me think. You see, sometimes I'm not sure if this is the correct one. Sometimes whatever it's packed in, like the activity can reduce because of this adsorption. Or I'm not too sure, but I don't know. I'm not too sure. Like I would go for C.
I'd also go with C because these glycerol trinitrate tablets, I think these are the sublingual ones, and with sublingual, I think you only want dissolution to occur. But now that I'm saying it out loud, dissolution.
But for the
Solutions is an
parabens,
aspect of adsorption.
but for the loss of antimicrobial activity in parabens, so it's just the degradation of parabens. There's nothing involved there with adsorption. If it degrades, it forms radioactive. It forms radicals. So we should review number 28.
Number 28.
We'll go to number 28, Shrina.
Frank, tell us.
Was in?
I think it should be D. Like randomized, like you 10 groups from this and you put 10
Frank,
groups here for control.
what do you mean? Just unmute and explain.
Or like we select the groups randomly
Yeah,
before the test begins.
yeah. What is cross-sectional study?
I think we had marked somewhere survey, something to do with survey.
We were confused on these two questions actually. For this,
Cross-sectional studies are observational. They are not even practical. They are observational studies.
so A is out, B is out. I think it's yet C.
I think the question was framed wrongly. It was maybe it's supposed to be not because I think it's required for cross-sectional studies. No, I don't know.
Let's not waste time here. Like, let's just go to the other question. We'll decide. Mtajua hapo mbele answer ni nini mkipata board exam.
For this, I think D is the answer for number 43. I think D is the answer because like parabens are usually used as preservatives, yeah. And the activity decreases.
Number 43, you think?
D, loss in antimicrobial activity of parabens. It's not related to addiction.
Yeah, that's what I was also suggesting.
Okay,
Parabens.
let me read something. Let me read something here. A possible adsorption mechanism of amphiphilic fiber for parabens was proposed in scheme 1 with PUB, of which I don't even know what it is, as the model compound. There are two kinds of interaction force, hydrophobic interaction and hydrophilic bonding interactions. So there's something with adsorption and with parabens, though I don't even understand well.
Okay, so the reasoning for why it is not C is because C this tablets, the absorption is there to for it to be stable. So there's adsorption to related. I don't know how to explain it.
Would that be adsorption or absorption?
Think both.
As a joke, ChatGPT is saying it's hemodialysis.
Sorry.
GPT is
Yeah. Let me send the explanation it's giving. So you all might be arguing between two wrong answers.
I think ChatGPT is sleepy. Yeah, but
Yeah, but
only
ChatGPT is not always right. So don't take it so hardly.
Someone define adsorption in simple terms.
But according to Google, uh, parabens, it has some kind of relations with adsorption. So for these tablets, I think they decrease the potency instead of increasing. So I'll go with choice C.
I think we should discuss this on a fresh
I don't
day.
know if you will agree with me.
We should discuss from here on a fresh week.
Where's the Chile for the anti-cancer drugs?
The Chile for the anti-cancer.
The Shori for the anti-cancer drugs.
Shori for
I think choice C is correct. Increase in potency of glycerin. Adsorption, and like they want us to confuse with absorption. It is not even related. Nitroglycerides are given sublingually, as he said, and adsorption doesn't play any part here.
Yeah, I agree.
Or maybe they want to say there are nitroglycerides which are in form of patches, patches.
Unanisikia?
Yeah.
Yeah, Frank.
On number 28,
Uh-huh.
So usually during experiments, the control, we usually have two groups, yeah? You have the negative and the positive control, yeah? So the negative control, you give the placebo, and the positive control, you give something that is already in the market and it's working, yeah? Then you have the test. You give them the test drug, yeah? That's what I was trying to say. So you see, it's saying that you give the control group a similar drug to the test group. I think that's wrong. D will be a better option.
I second.
Actually, now we are past our time. Good night.
That's why I was saying we should discuss our doubts on a fresh week. This next week.
Discuss what?
We should continue from there next week.
Yeah.
Okay, please, before we wind up, just one question. Nitroglycerins. Hello?
Yes, yes.
Yes, we
Yeah, we can hear you.
Yeah, nitroglycerins. I think we have also patches. That's where the adsorption will come in, maybe.
Yeah, we do have patches.
Yeah, maybe that's why. But I don't
So
know the
all the
answer yet.
maybe hemodialysis, I don't know.
Maybe.
No wonder ChatGPT imesema hivyo. We don't know.
Saa hiyo tutamkia kesho.
Inshallah.
Good night.